On this Thursday night, trying to blunt the impact of Omicron. The call for a circuit breaker in Ontario.
Data is very clear that this is incredibly transmissible.
Are more restrictions coming? Plus, why frontline healthcare workers hope the variant will be easier to treat as frustration mounts for pandemic-fatigued travelers. Some revealing moments in a year-end interview with the Prime Minister.
One moment that touched me perhaps more than anything else.
What he had to say about the two Michaels and sexual misconduct in the military. And lost hope in Afghanistan.
There's a 10-year-old girl who was shot in the face when she should have been on her way to Canada.
Why are Afghans approved to come to Canada not getting here?
Global National with Donna Friesen.
Good evening and thanks for joining us. We are continuing to track the rapid spread of Omicron tonight and its impact on all our lives. In Quebec, case numbers are surging to record levels, and the Premier has just announced public health restrictions are being reimposed. Starting on Monday, all businesses will be limited to 50% capacity. Bars, restaurants, theaters, and places of worship will also go down to 50% capacity. With the holiday just around the corner, social gatherings will be limited to a maximum of 10 people indoors.
Everyone has a great responsibility. If everyone does their part, we can get through this together. I'm counting on you all.
The Montreal Canadiens have announced no fans will be allowed at tonight's game in Montreal at the request of provincial health officials. In Ontario, science advisors say immediate intervention is also necessary and are calling for another so-called circuit breaker of measures to reduce social contacts by 50%.
This will likely be the hardest wave of the pandemic. But if we can control it and drive vaccination as hard as we can make it to the exit. It's not a lockdown. It's not a stay-at-home order, but it does require reduction in contacts.
Ontario is accelerating booster doses, which offer greater protection against serious illness, and it is limiting capacity at big venues like sports arenas. But without further measures, the science advisors say admissions of COVID patients to critical care could, in a worst-case scenario, reach 600 by the new year. That is assuming Omicron is as severe as Delta. Early evidence shows milder infections, but there's not enough data to say for certain, and the variant is moving faster than we can react. No new public health restrictions were announced in Ontario today. As Abigail Bimman reports, Canadians are left bewildered, frustrated, and not sure how worried they should be.
It's been so long, more than 2 years, and well, I think we deserve to go to visit our families.
Calgary's departure wing still busy after a new advisory from Ottawa warning against non-essential travel.
There is some concern, what's going to happen coming home. We're gone for 6 days. Are the borders going to be closed? Do we have to quarantine for 2 weeks?
We are anticipating a very busy Christmas season.
WestJet is slamming the blanket advisory, calling for more data. And while they expect some cancellations and say Canadians have that option, they also point out we've seen this advisory before.
The level 3 travel advisory was actually in place all summer long and into the fall, and we carried the most guests that we've ever carried throughout the summer since the onset of the pandemic.
The difference now, Omicron already dominant in Ontario, and new modeling from the province's science table warns it could have greater impact than any variant yet. That modeling predicts if nothing is done, cases could rise to 6,000 to 10,000 a day in 2 weeks. Ontario topped 2,400 today.
It transmits incredibly fast.
With evidence 2 doses of Pfizer are less effective against Omicron than Delta and 3 are better, the science table is calling for a boost to the booster campaign and a circuit breaker.
I believe we can do this without closing schools or shutting down businesses that have suffered during previous waves. But it will take serious restrictions that reduce contacts.
It's going to be a tough December and January. It absolutely will be. But like everything else, we'll get through it. We got through wave 1, 2, and 3. We'll get through wave 4.
If you do choose to travel this holiday season, there's no one-size-fits-all answer about insurance.
The group insurance, pretty clear, you probably will be covered. I think the real question is around those who have purchased individual plans.
Experts warn in addition to checking your policy, you need to check out hospital capacities where you're going and consider what may happen if you test positive at your destination and have to quarantine there. Abigail Bimman, Global News, Ottawa.
COVID cases are on the rise across the country. Both New Brunswick and Nova Scotia are reporting their highest daily caseload since the start of the pandemic. Manitoba is reporting its highest count since June. Quebec confirms more than 2,700 new cases today. That's the highest since January. In Saskatchewan, booster doses are being accelerated in anticipation of Omicron taking hold there. Starting Monday, all adults will be eligible for a booster. The gap between second and third doses is being reduced to 3 months, and people are being urged to book as soon as possible.
Unfortunate, I know, after 21 months of dealing with COVID-19, that we need to today just conduct ourselves in our communities with a significant degree of caution.
No new restrictions were announced today. The Premier says the focus is on boosters and free rapid tests that are being made available by the province. Once again, we are looking overseas to countries already engulfed in Omicron. And in the UK, the picture is not positive. It reported more than 88,300 new infections today. That broke the daily case record for the second day in a row. Even if Omicron proves to be milder than previous variants, UK health officials say it could still lead to a surge in hospitalizations because of the sheer volume of cases. Plus, healthcare workers are being infected and having to stay home. Redmond Shannon reports on the surge and the response.
The last scramble to Paris.
Yeah, no, luckily we arrived.
Starting Saturday, only French citizens and residents can freely travel to France from the UK. Another response to the rapid spread of Omicron.
It's crazy. It's already spread in France. It's the same in the UK when they banned from South Africa. It was already there.
Omicron is seizing European leaders at their first summit of the post-Angela Merkel era, with many countries tightening travel rules, superseding the EU-wide COVID pass scheme.
With the increased spread of the virus that we are seeing in many countries right now, I can understand that governments take even further precautions.
Before Omicron, there was Alpha, first detected in Kent, England. Prime Minister Boris Johnson was there on Thursday. Dismissing the idea of locking down a pandemic-weary population, despite the UK breaking another daily record for new cases.
This is very different from last year because what we have is the additional protection of the vaccines and the ability to test.
The UK's Health Security Agency estimates those infected with Omicron are passing it on to an average of 3 to 5 others. South African data suggests hospitalizations and deaths may be lower, but Western countries like Canada may be watching what happens in the UK more closely.
The earliest that we will have reliable data is the week between Christmas and New Year, and probably early January.
The Queen has cancelled her traditional pre-Christmas family lunch as a precaution, and more soccer matches have been postponed amid a record number of infections in the Premier League. From the palace to the pitch, the impacts of Omicron are everywhere. Redmond Shannon, Global News, London.
The situation and the rules are changing fast. Canadians have been advised not to travel outside the country, but several premiers have voiced concerns after Tuesday's meeting with the Prime Minister. The travel measures are being put in place without the science to back them up. Our chief political correspondent, David Akin, is with me now. David, what are you hearing?
Yeah, well, that's exactly it, Donna. We have heard concerns from some premiers' offices that they felt the Trudeau government was trying to use that First Minister's call earlier this week to build support for new, tougher travel restrictions, including renewed quarantines and bans on inbound travel by non-Canadians. An aide in one premier's office used the phrase political theater to describe the Prime Minister's call with the premiers because they say the Trudeau government did not present data to back up requests for new travel restrictions. And that is an important issue because it's easier to get the Canadian public to accept tough new rules they may not like if there is, in fact, evidence those rules work. But even Dr. Howard New, he's Canada's Deputy Chief Medical Officer of Health, he conceded that sometimes Cabinet is making decisions despite the absence of data.
We recognize that there are other considerations in play as well beyond just a strictly sort of technical public health advice that we may be giving to ministers.
David, the government did not impose a travel ban. It is an advisory, and there's still a travel ban, though, on people coming from 10 African countries, which many think should be revisited. Are we likely to see changes in other travel restrictions in the future?
Quite possibly. Here's what the Transport Minister said this afternoon.
I could tell you and Canadians to expect measures to be changed at any time.
But if rules are changed, the message from experts is explain why.
You really have an obligation ethically, if you're going to restrict freedom of movement, to explain to people exactly how this decision was made.
Now, in the meantime, the only existing travel ban, as you mentioned, is the one on travel from those African countries. And that ban, we're told, is now under review. Why? Because there is no data to suggest it works. Donna?
All right, David Akin in Ottawa, thank you. We are going to put your questions about Omicron to the experts. You can send any questions you have to yourquestions@globalnews.ca. Well, COVID-19 was one of many complex issues the Prime Minister had to deal with in 2021, from an increasingly belligerent China to the crisis in Canada's military and winning the election. Prime Minister Justin Trudeau has had successes and failures this year. Our Ottawa Bureau Chief Mercedes Stevenson interviewed him today. Mercedes, what stood out to you as the Prime Minister turns the page on 2021?
Well, Donna, we started out with the COVID discussion, and it was really what we've been hearing from the government over and over. But where we got some interesting depth from Prime Minister Justin Trudeau was on what happened when the two Michaels came home. And as you just mentioned, it was one of the standout moments, not only for the government, but for Canadians this year. In the interview with me, Prime Minister Justin Trudeau revealed what Michael Kovrig said to him when they landed back in Canada, that he told the Prime Minister he, in fact, had done the right thing by refusing to do a prisoner transfer for Meng Wanzhou. Here is what the Prime Minister told me about that.
It was surprisingly emotional on a personal level, because as a leader, as a Prime Minister, you want to do the right thing. You know what the right thing is, but there's a human cost. These two Canadians were stuck in terrible conditions, totally arbitrarily, and there was at least a theoretical way of me taking shortcuts and backroom deals to get them home. But I knew and I felt that you had to do the right thing, and we stayed the course on the right thing. And to hear one of the Michaels say to me, you did the right thing, was satisfying on a personal level in ways that surprised even me.
And the Prime Minister also talks about taking a tougher line with China and a tougher line with the Canadian Armed Forces when it comes to sexual misconduct. He talked about what the top generals and admirals told him when the sexual misconduct scandal first broke.
When the very top levels of the military are insisting that there is no problem, it is a challenge for any government to say, okay, you're wrong, we're going to get rid of all of you, we're going to bring in an entirely new system.
The Prime Minister says he wishes he had done more sooner in retrospect on the sexual misconduct scandal. There'll be more later, but back to you for now, Donna.
All right, Mercedes in Ottawa, thank you. In Conversation with the Prime Minister will air in full on Christmas Day and on the West Block on Boxing Day. Afghans still waiting to get to Canada. Coming up, the tragic impact of delayed rescue efforts. The last remaining members of a group of missionaries, including one Canadian captured and held hostage for 2 months in Haiti, are finally free. Police in Haiti say the 12 hostages were found on a mountain. The 17-member group from the Ohio-based Christian Aid Ministries was kidnapped by a gang in October after visiting an orphanage in Port-au-Prince. Global Affairs Canada says it is aware of the case and stands ready to provide consular assistance to the Canadian. Well, during the last federal election, Justin Trudeau promised to bring 40,000 Afghan refugees to Canada, including those who supported the Canadian military mission in Afghanistan. So far, about 5,000 refugees have arrived in Canada. 5,000 others have been approved but are still waiting overseas. For those trapped inside Taliban-controlled Afghanistan, evacuation efforts have stalled. And as Jeff Semple reports, the delayed efforts just cost one girl her life.
Speaking by phone from Afghanistan, Bashir tells me his 10-year-old daughter, Nazifa, was very bright, at the top of her class. She was learning English and really excited to move to Canada, he says. We're protecting Bashir's identity because he worked for the Canadian forces in Kandahar. After the Taliban took over in August, his family was approved to move to Canada. but they're stuck with no way out of the country. Last week, Bashir's family was driving past a Taliban checkpoint. They thought the guard was waving them through, but then one of the Taliban started shooting at their vehicle. The bullets struck and injured his brother-in-law and his niece. Bashir's daughter, Nasifa, was shot in the head and didn't survive. It's unclear why they were targeted, but Bashir believes it was because he had worked for the Canadians. I am lost. My daughter is gone, and I'm afraid for the rest of my family, he says.
There's a 10-year-old girl who was shot in the face when she should have been on her way to Canada. I can say that with no doubt in my mind. This was avoidable. And it was bound to happen.
5 months since Ottawa announced its special Afghan refugee program, thousands who supported Canada's military are still in hiding. Many still waiting for Ottawa to process their applications.
We cannot stay here anymore.
This former interpreter submitted his application last summer and hasn't received a response. But he did receive this letter from the Taliban ordering all those who have worked with foreigners to appear in court, or the Islamic Emirate will deal with them according to its laws. He's considering turning himself in to save his family.
All the night, my daughter and my wife are crying, crying for their future.
Since the Trudeau Liberals won re-election in September, until the first week of December, Ottawa approved 165 Afghan refugee applications. That's an average of fewer than 2 per day, with 30,000 still to go.
But we need to do better. We need to pick this up. We need to get the log jams resolved.
The reality is, Mr. Speaker, we've made a substantial contribution.
A spokesperson for the immigration minister says several flights arrived just last week, carrying hundreds of Afghans. They include Sahil, now preparing to celebrate Christmas at his new home in Niagara Falls. But Sahil's Canadian sponsor says the government is misrepresenting the numbers.
Canada, since the fall of the air bridge, has gotten nobody out of Afghanistan.
The recent arrivals, like Sahil, are privately sponsored refugees who are already living outside Afghanistan and eligible to come to Canada, part of a separate program from those who supported the military and remain trapped.
We need to focus on finding a viable solution within Afghanistan to get people out.
Ottawa expects it will take 2 years to bring all 40,000 refugees to Canada. Not soon enough for most families, and already too late for Nasifa. Jeff Semple, Global News, Toronto.
Ahead, scenes of devastation as more wild weather rips through the U.S. In Australia, there's devastation for the families of 5 children. They died after a bouncy castle was caught in a gust of wind and lifted 10 meters into the air. It happened during an event to mark the end of the school year. 2 boys and 2 girls were pronounced dead at the scene. Another child died in the hospital. 4 others are in critical condition, and police say the victims were in grade 6 and between 10 and 11 years old. There's been another bout of wild weather in the United States. Tornadoes, damaging winds, and a massive dust storm ripped through the U.S. Midwest, killing at least 5 people. The powerful weather front pounded Nebraska, Iowa, and Minnesota with hurricane-force winds and suspected tornadoes. If confirmed, the one in Minnesota would be that state's first ever in the month of December.
Sirens went off, went down the basement, just a loud bang. Everything went quiet and dark, and come out and the garage is gone.
We got power flashes.
Wind gusts topped 160 kilometers an hour, peeling back roofs and blowing semi-trucks over. And in Wisconsin, trees and power lines were knocked down, cutting power to thousands of people. States of emergency have been declared in Iowa and Kansas. The extreme weather system has now shifted north to the Great Lakes and into Canada, where several winter weather warnings are in effect. Healthcare worker burnout next, what it will take to turn the tide. None of us can quite believe 2021 is going to end with another variant having a stranglehold on the world. And it's people who work in healthcare who are bearing the brunt of the anguish in this pandemic and who now look to 2022 wondering what's to come and how much more they can take. Jamie Morocker has been talking to some of them.
Even with small reminders around, like this tiny tree or these shiny baubles, it's easy to forget about the holidays. Instead, Tasleen Nimji and her staff are preoccupied, preparing for another wave.
Time is not on our side here with how quickly Omicron is spreading.
On the front lines, that means workers reaching for N95s over surgical masks again. Nerves here are shot. People are simply exhausted.
We're already dealing with staff shortages and high volumes. And so that's a challenging environment to work in. And now you're layering this on top of that.
Critical care capacity is likely to be tested once more. That work is some of a hospital's most demanding under normal circumstances. And just one new Omicron case among staff could force entire units into isolation.
We might be looking at nursing ratios that need to be 1 to 3, 1 to 4. And that brings up its own issues in terms of how do we keep everybody safe.
Frontline workers have seen this before. Hospitals in Alberta and Saskatchewan buckled under the strain of the third wave. Provinces like Manitoba have already asked Ottawa to send help, more ICU nurses, knowing what could happen if an outbreak occurred. At Toronto's Mount Sinai Hospital, nurse Sarah Beth Silver works with some of the most vulnerable, cancer patients. She knows she has to do everything she can to stay healthy, washing her hands, wearing masks, minimizing contacts, and getting boosted.
I think we're taking the lessons that we've learned from the first few waves of the pandemic to take it into this next phase.
Nimji says her teams are ready to borrow staff from other units and transfer patients if need be.
It's hard, but we have to do it. We got to do it.
Left with the hope Canadians will get their third doses to help those who are committed to helping us. Jamie Moronker, Global News, Toronto.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is the Halifax Public Gardens, established in 1867. And it's a special day for Nova Scotia. The population surpassed 1 million today, the first Atlantic province to reach that mark. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.